Hi. So I work for the NHS, and I'm supremely proud to work for the NHS. I'm both a paramedic and a community nurse.
Gosh.
My husband's a police officer, so we're right at the front of it all.
You're the backbone of this country, Rachel, aren't you?
Do you know
your
what?
family.
The backbone. I think this one's probably got a bit of scoliosis at the moment.
It's a niche medical gags. I love it. Go on.
Yeah, I'm feeling quite fragile.
Yes, I'm sure.
In the last week, I don't know what's changed in the last week. We're certainly going to more COVID positive patients.
This is precisely the conversation I had with one of my friends yesterday. So I think she actually said, I don't know what's happened in the last week, but it does feel everything feels different today from how it did a week and a half ago.
It certainly feels different for us. I think, speaking to a lot of my colleagues about it, we're breaking.
Yeah.
You know, I feel broken, but I'm really here just to make a plea to the members of the public. You know, your NHS needs you. We are humans. My colleagues, the paramedics, the ambulance crews, the doctors, the nurses, all of the teams. We're human, and we catch this awful disease. So please protect us. If you call us to your homes, if you know that somebody in that house is COVID-19 positive, please all wear a mask. Keep your space from us. Open windows, please. When you talk to people, when you phone 999 and ask for help, if it's for the police, if it's for the fire brigade, please do the decent thing and look after them. Because
are you getting a lot of people who aren't?
Every day, James. Every single day, I walk into people's houses and the information comes through on our computer in the ambulance. My stomach drops every time I see the words COVID risk, COVID-19 positive. And, you know, I do what I can to, you know, I'll try and call the family before I go in. I'll introduce who I am. I ask them to put masks on.
And I know you're not giving them jip here, because they've got so much going on, and 90% of the time it'll be just genuine error or omission, but the reminder becomes ever more important, doesn't it?
It does, but the abuse that we get back from it. But I don't feel unwell. Why am I wearing a mask? I don't believe in it. I don't. You know, even when their family members have tested positive, the abuse that we're getting, and it's really wearing, James.
I'm sure it is. And I mean, I don't know if I have to apologise on behalf of people in my profession who've contributed to this undermining of the mask safety, but I do anyway. And what I would I urge everybody listening to do is to listen not just to Rachel's words. I hope you don't mind me saying this, Rachel, but listen to her tone of voice as well, because I suspect you normally sound a bit chirpier than you do today.
I think it's probably right. Yeah, fair to say I'm known for being a bit more chipper. But right now I'm tired. I'm tired.
What's the toughest thing? What's the toughest call you've been on this year? I'm not being mawkish. I've got a reason to ask you this, and then you'll find out what it is when you've told me. Or one of them. I mean, I know it's one of those things that people always ask ambulance crews. You know, what's the worst thing? You know, I don't ever like to relive the worst thing, because of course
my worst thing is 1,000 times worse than most people's worst thing.
Yes.
But I would say I think the worst thing at the moment is the disrespect of the ambulance crews, of the police officers, of the fire brigade, of the doctors, of the nurses, where people are not doing their level best to help us. They can help us. You can help us. Please just give us space. Please let us do our work. But we are so... Our staff, my colleagues, we're dropping like flies.
This is what I'm hearing.
And the distances we're travelling to help people across counties. We're travelling to help people. And I don't know.
No, you've said it. You've said everything you need to say. And I'm just going to apply some punctuation, if I may, because I'm going to tell everybody listening, whether you are unfortunate enough to have somebody like Rachel has just described in your life or in your family, or whether you are that person yourself, okay, what are you going to ask of her if you ring 999? What is Rachel, who you've never met and whose name you may never know, if she arrives on your doorstep with her colleagues, with the ambulance at the bottom of your pot, what are you asking of her? You're asking her to put herself in harm's way and to prioritise your family member or your own health above her own. And she will move heaven and earth, like all of her colleagues, to do what she can to help you, a complete stranger. And all she's asking you to do is put a bloody mask on.